Did you know that according to the Centers for Disease Control and Prevention, 1 in 4 Japanese encephalitis cases are fatal?
Hi, I am Dr. Wilson. I am a consultant pediatrician and a pediatric infectious disease consultant in KPJ Seremban. JE or Japanese encephalitis is a virus that is spread via bites by infected mosquitoes of the Culex species. And this disease is more dangerous in children because majority of the cases that is been infected are mainly in the children age group, usually below the age of 15 years old. And as we know, Japanese encephalitis is dangerous mainly because this disease has not got a cure. So if you are being infected by the Japanese encephalitis virus and you are symptomatic, there is a very high likelihood, about 30% of those who are symptomatic may progress to very ill and even death. And even in those who actually survive from the severe illness, about 50% of them will end up with very severe disease like severe neurological deficits, such as unable to do activity of daily living because they would be dependent on other people to take care of the children. Therefore, it is very prudent for us to know that this disease is actually in our country, and not just in our country, but mainly in the Asia-Pacific region. In Malaysia, as we have mosquito around the whole year round, so JE infection or the risk of getting a Japanese encephalitis infection is high all year round. And as mosquito can travel nowadays, not just flying within the range of 1 or 2 kilometers, but mosquito can travel in transports, in the car, in the aeroplane. Therefore, this disease can actually not just occur in the rural area, but also in the urban area. So it is important for us to be careful that and aware of the Japanese encephalitis disease, even though you are not staying in the rural area. There is an incubation period of about 5 to 10 days after bitten by mosquitoes. And after that, usually the children or the adult who are being infected may show signs of fever, weakness, malaise, lethargy, which is non-specific. But however, if this virus later on invade into our bloodstream and was brought to the brain, it can infect our brain cells. And once the brain cells is been infected, this will present with a more severe type of symptoms. So which is consistent with what we call as encephalitis, which is the infection of the brain cells. And when this happens, there will be confusion in the patient. There will be also tremors of the limbs. They can have severe seizures or hypertonia, which is the limb become very stiff. There can be other various symptoms of neurological deficits, such as like drooling of saliva, loss of speech. So all those are the more severe side effect or symptoms of Japanese encephalitis. The JE vaccine has been actually available for the past 40 years. However, the technology has changed over the years, all right? So, and then the latest JE vaccine, which is available to us, which is the recombinant chimeric vaccine, is actually very safe. So it has been used in our country, especially in states of Sarawak, since the early year 2000s. So, and thousands of children or even adults has taken the vaccine, and not many of them actually have any severe side effects. So actually the vaccine is actually very safe for us to use. If parents parents want to get vaccinated for the JE vaccine, I think the first thing is they have to consult the family doctors or the pediatrician concerning the availability of the JE vaccines in the clinic. Then they can ask the doctor to do an examination of the child to make sure that the child is well and able to receive the JE vaccine. For those who are below 18 years old, require them to get 2 doses. The first dose at any time after the age of 9 months old, and the second dose is usually 1 year after the first dose. Only in Sarawak, the vaccine is included in our national immunization program in Malaysia. However, most of the vaccination book in the private sector would have included the JE vaccination as the optional vaccine available in their vaccination book. So it is prudent for the parents to check the vaccination book so that they do not forget of the JE vaccination. And also they can ask the doctor to give them a reminder when the child is at the appropriate age of 9 months old when they need to take the first dose of the JE vaccine. It is important for the parents to remember that because JE is not a very frequently encountered disease, but the JE is a very devastating disease for children. The incidence of JE in Malaysia are not as high as the other mosquito transmittable disease like dengue. However, the consequences of the JE infection, as I mentioned earlier, will leave a very severe sequelae of neurological deficit for the child or adult after the JE infection. So therefore, the parents must always remember that although this disease is not the commonest infectious disease in our country, but because the outcome is so poor that they should always remember that there is a vaccine that can prevent this very severe disease. And more so that this disease, once you have contacted it and you have infection from the Japanese Encephalitis virus, there is no cure for it. And whatever treatment that is subsequent to the infection is mainly a supportive treatment. So meaning that there is no medication that can kill the Japanese Encephalitis virus once it has entered our body. So the best way to treat this disease or to even prevent this disease is to get your JE vaccine as soon as possible to protect your child and protect your family from this devastating disease which leaves behind a severe neurological deficit.